Hello, everyone. This is Faye, and this is day 4 of planning Medicare sales year round. I'm so happy that you've been able to join us throughout the 4 days. If this is the first day that you're joining us live, welcome. And we're going to do a little bit of catch up. But let me first of all say that there are 2 people here who I personally want to offer an apology to. Somehow, in our busy and hectic schedule, I have confused 2 people with the same name. And therefore, your emails have been crossed or deleted or what have you. But we're getting that straight. And I asked my VA to go back and send each of you all of the emails that we have sent out. Those emails will have attachments for all of the forms that we've used during the course. It will have the recordings, how to access the recordings. So if you feel that you're missing anything, then reach out and let us know. That should be all in place for you. You should see a number of emails from me, fayhorton9@gmail.com. No, I'm sorry. It might be from fayhorton9 I Sell Medicare Plans. So if you don't see it, look in your spam. And please accept my apologies. I want everyone to have everything that we have available. And if you, anyone else feels that you've missed something, then by all means, reach out, text me or email and let me know. And we'll certainly be able to get it to you. Thank you both. Thank you both. I'm so happy that you're understanding. To work with seniors, you have to be understanding. So in day 4, we're going to do some wrap up. Kayla asked, was the activities list sent? Yes, it was in an email, or there was a link in one of the emails, Kayla, that gave you access to the activities list. So if you do not have it, I'll make a note, Kayla, that you don't have the activities list. So when you all see me looking over to the side, I'm taking notes. So I don't try to leave everything to my memory to do, but I want to make sure that I do everything that I say I'm going to do, because that's important. So to start today, I want to clarify a couple things from yesterday. 5-star plans were discussed. And in that conversation, I said, and probably I don't want to give you the impression that it is year round. These are the dates that you can write a 5-star plan. December 8th through November 30th. So the first 7 days of December of any year, you cannot use an SEP for a 5-star plan. That's the exception. So it is technically year-round. You can use it every month, except in the month of December, you cannot use 5-star plan as your SEP from December 1st to December 7th. I want to make sure everybody is aware of that, and you know that.
Wait, I'm unclear. I thought you said you can. Okay, so you can use it December 8th through November 30th of the following year. Am I right?
Of the next year.
Yeah, of the next year.
You can start December 8th.
Okay.
With 5-star plans. It's gonna, if you write a plan on December 8th, it's gonna have a January 1 effective date. So it's for the next year, right?
Yes.
So if we use today's date now, you could write a 5-star plan today with a January 1 effective date. And because all of those 5-star plans effectives have to be in the year that's coming up, the last day that you could write and use an SCP for a 5-star plan will be November 30th, 2023. Because then it would be December 1st. And after that, it's January. And you can't start writing it again until December 8th.
Okay, now I understand. Thank you so very much. I didn't know that. Thank you.
You're welcome. And I thought about that after, and that's one of the reasons why sometimes the replay is late getting up, because I need to go back and listen and make sure that I'm not giving you wrong information or incorrect or confusing information. I want everything to be clear for you so that you understand it. So everybody's got that now, right? Craig says he didn't get the link to the OEP checklist or the activities checklist. Now, when you won't get emails and it says click here, the word here, that's where you're supposed to get it. Or there's no link. You just click on the word, whatever the word says. And if in your email it's underlined, then that's anywhere in that underlined portion is where you click. So check that. If not, I mean, I'll make a note, Craig, that you don't have the OEP checklist, which was the very first checklist, and you don't have the activities. I think perhaps you might be missing, some of you might be missing the click here to get it, because it's not a link all the time. It's just the word that you have to click on. Okay, the second thing that I wanted to just review from yesterday is the CRM link. Did everyone get the email from last night? And there is no link for the ultimate checklist yet. We're doing the ultimate checklist today. Did everyone get the CRM link and where to click for the CRM link in your email last night? If you did, say yes. If you didn't, say no. If you're not sure, say not sure. It's okay. Okay, so everybody's got the CRM link. Let me make it clear. The ultimate checklist has not been given to you yet. And Courtney says she did not get the CRM. And Joyce says she's not sure. Courtney. Okay, well, the CRM is less annoying CRM. And it's just like it sounds. Less, LESSANNOYING. And so before today is done, I'll put that link in the chat. And the advantage to your using that link is instead of having a 15-day free trial, you have a 30-day free trial. And then I'm not sure if it's either $15 or $19, but it's less than $20 a month after that. And they will notify you when your free trial is almost up so that you could go ahead if you want and actually use it. But if enough of you are actually signing up for that CRM, then I'll offer a session where either the CRM representative can walk you through how to, they'll transfer your database for you. and they will also help you to set up your different groups and accounts and walk that through you. And then there's also videos that can show you how to do that. But I know if your time is as valuable as mine, and it is, and you may not have the time to watch all those videos, if enough people are interested in doing that particular CRM, then I'll set up a session when someone can actually walk you through it and you can ask questions. Would you like to see something like that? Again, this time, let's do ones. Ones if you'd like to see something like that. Twos if you don't care, you already all set. So let me know and I can arrange to get that all done for you. Thank you so much. Plenty of ones, no twos. Mary Lou says that would be awesome. Great. Okay. Then I'm thinking that's something I could set up for you next month. Your assignment yesterday was to be able today to give us one provider office or provider that you're reaching out to, that you've either already decided that's who you're going to contact to do provider marketing, or you want to work with that particular provider, and it could be a doctor, a dentist, or a vision care provider. Who wants to volunteer to be first to tell us who you're going to work with?
Hey,
You want to?
Courtney Francis here.
Yes, ma'am.
I'll jump in. I'm going to be
Okay.
working with Dr. Chris Bloom. He's with WellMed, which means he's with United Healthcare exclusively. I started working with him last year, AEP of 2022. But then I became a captive agent, so I sort of dropped off. But I've known Dr. Bloom for many, many years in New Orleans. He moved here after Hurricane Katrina to Dallas. So I've already have a relationship with him. I've already given him one patient. She is elated with him. He loves her. So I'm going to try to use your strategy of saying, hey, I can bring more patients to your office. And hey, can I be agent of the day one day in your office? So that's my plan, Dr. Chris Bloom.
That's a great plan. And if his WellMed office is like most of the WellMed offices, they have a conference room.
Yes.
And because you're working directly with UHC, you may be able to get the manager, the field manager, to have your meetings there, have meetings there during the AEP.
Okay.
And have something there, for your monthly event. You may want to schedule something there. And you also can possibly use that office for member appreciation sometime during the summer and invite the DSNP population that's in the zip codes around the office.
Excellent. I made note of that. Thank you.
Okay, you're welcome. Because they work exclusively with UHC, it makes a good partnership. And most times whatever they have available is open to you.
Mm-hmm. In terms of resources?
Yes, in terms of it, like if they have a conference room, you could use it. Even if you're in the area, you need to meet somebody to do an appointment and you need someplace to rest your laptop.
Okay.
You just have to get to know the office manager very, very well. The other thing that the WellMed office here does is, if there's someone who's new to the office or new to the area, they will, if I call, the office manager will set up a tour. Okay. So the prospective member can go in and tour the facility and get to actually shake hands with the doctor or the staff.
Excellent. Thank you.
Okay, who else has an um, provider that you're going to work with? Now, provider marketing is not something that you must do. It's just another way that you can actually plan to have a place to meet people. And when you create that relationship, it's a two-way street. You're bringing value to them by adding patients to the office. And then as people turn 65 in the office, they'll give them your card.
I'll
So
go
does-
next.
Okay.
I have a dentist that I've gone to for quite some time, and he gives discounts to seniors. So I'm going to approach him.
Good. I know that you do a lot of Medicare supplements, and do you do a lot of the AARP Medicare subs?
Oh, yeah, primarily.
Okay. Well, the Medicare, the
And
AARP Medicare sub includes a discount for the dentist. And so your dentist probably will take that discount for your members as well.
I'll check with him.
Yeah, they, all of the med subs for AARP have the dental discount, and they have the vision discount, and they have the fitness center in most of the areas. So those are just additional things that you can, show your customers that they might get over some other company subs.
I'll check into that. I don't know about my doctor. I've got a new doctor. My other doctor went concierge, so I lost him. And it's with Baylor Scott and White here in Dallas. And I know they're very associated with Humana, evidently, because they've got people with Humana tables there during the AEP.
Yeah, and because Baylor Scott has their own plan too, that might be a little difficult, to create the kind of relationship that you want. They're probably definitely going to want you to write only Humana too.
Mm-hmm.
I don't know why I have such a problem reading my chats. Maybe it's because I need to close something up here. Maureen, I can only see a part of your chat. We work with the Dedicated Senior Medical Center. Dedicated is a group like yesterday, you guys will remember I mentioned Village Medical. Dedicated is a group like Village Medical. They're popping up all over the country. There are a few here in Florida, and there are some in Missouri. And I don't know where are you, Maureen?
We're in outside of Detroit, Michigan.
Okay, so they're in Michigan as well. But these groups, they understand the importance of that relationship between a broker and their office. So that should be a great opportunity for you, Maureen.
Yeah, we really like the facility. It's so much nicer than I anticipated walking in.
Mm-hmm. Do they have like a conference room that you might be able to use?
They do have a conference room. That's where they have their activities. And that's where we had our no attendance Medicare 101. But
Mhm.
it was kind of good because Shannon and I didn't really know what we were doing. We were nervous. So we just performed for the staff. So it was
Well, next time you'll be prepared, and
Uh-huh.
you will also have some ideas probably from this course
Oh.
of how to actually drive more people
For
there.
sure. Well, we thought that they had told us that they were advertising it. We put out some, it actually was in an area that isn't near our office or where we live. It was at a different center than what we normally go to. So our clientele wasn't really apt to go to that facility to hear our thing. But
Okay,
it worked
but
out.
now you've created a new area for yourself to work. And
Uh-huh.
if it's not like 15 minutes away from where you are working, then you may want to put in your plan for next year to work that area, learn
Right.
all the
Oh yeah, we've learned so
centers and
much this
everything.
week. Thank you.
Okay, okay. Mary Lou wants to know what's the no attendance Medicare 101. I'll let you tell her, Maureen.
Well, it was intended to be a general Medicare 101 going over, all of the ins and outs, but nobody showed up. So we were just there.
That's the and listen, that will happen, particularly with your first one. And if you haven't, gotten information out to enough people to attend. So it can happen. Don't be discouraged by it. Keep doing it. Make sure the word is out. So if consistency is important with these things, you got to have same day, same time, and you may have to change it around a few times to figure out what works best for the audience that you're trying to reach. Now, some areas, there may be a lot of people who have Medicare, but they're still working. And then there may be other areas where most of them are retired. So when you're looking at your demographics and doing your planning, those are the things that you want to see. You want to see what kind of industry is around there. You want to check to see if a lot of the people are working or they're not working. Who's the largest employer? The other area where you may want to drive people to a Medicare 101 would be small employee groups, where the people are going to be turning 65 and need to come off the group plan. So there are many, many ways that you can find people that you can actually help in your area. And once the word of mouth starts to get around, it just creates referrals for you. Maureen asked, do you use a projector? I don't use a projector. I talk loud and I am loud. And most of my Medicare 101s, I will only accept a small number. So if I were doing one of the 101 events where I'm paying the $2,000 to $3,000 for a vendor to actually pack the room, and I had 50 to 100 responses, then yes, I would use a projector. For the ones that I do with my local marketing, I don't use a projector. I'm more of a personable person. I try to keep it that way. And I want to be able to just talk to the people personally. I want to be able to greet them. So I keep my number. I try to stick to it. Sometimes it's more than 15, but I try to stick with 15, particularly with COVID and distancing and everything. I try to just keep it small so you could do more meetings in smaller groups. And sometimes smaller groups are more effective than trying to talk to 100 people at one time. If you don't have someone who's going to help you to corral 10% of those people so that you can set appointments with them, it's difficult. But if you got 15 people, you can really work the room. You can talk to them individually as they come in. You'll get to know them. You'll know where they live. It just makes it more personable. So the personable ones, in terms of return on investment, number of applications or sales that you eventually write, should be higher than if you're doing one of the very, very large ones. And it all depends. Does that help you, Melanie? Although you asked Maureen. Maureen, did you use a projector?
We did, but we also had a system malfunction.
You always have to be prepared. So if the system doesn't work, you gotta talk, gotta back it up yourself, right?
Oh yeah, we had paper that we could go by, but we got the projector working.
Okay, good, good. Okay, who else has a provider assignment that you're going to work on?
I have, I like the idea of what you mentioned about having the primary care, the dentist, the optometrist or the ophthalmologist and the specialist. And especially for my DSNP clients. There's a dentist here in Sanford, Dr. Craig, and they've been going there for dentures. And he's been doing a really good job. So I was thinking about, looking at Dr. Shrivastava for the primary care and the dentist, Dr. Craig, and I have to find somewhere for them to go as far as vision is concerned, the vision benefit, and the specialist, and I'm thinking about a cardiologist.
Good. When you have those providers in place and you know that they understand the plans that you're offering, all it does is helps when you're talking to your customer, it makes it easier for them.
Mhm.
And with the DSNP audience, it is important that you're able to make everything easy for them. They don't, if they got to think about where they have to go, just say for even medical services, if they have to really think about it, they're going to go to the emergency room. And that's not what you want them to do. You want them to go to the primary care doctor. So you need to be able to tell them confidently that, yes, this primary care doctor's office is open from this time to this time. If there's an emergency or you need to see the doctor during the day, they're there. And after hours, they have 24-hour call. Those are the kinds of things that will help them to utilize the plan better. Right now, DSNPs are very, very interested in how much is the over-the-counter and how much money that is. But it's still based, all of those things are based around a medical product. So they need to know how to use all of the plan benefits. So you're going to help them learn how to use their card to shop for whatever food or pay the utility bills, but you will also need to try to help them, educate them, connect them to the right providers so that they're able to use the plan easily. Very good outreach, Deborah. Does anybody else want to share your provider?
Hey, Faye, this is Courtenay. I am going to be reaching out to Dr. Thaddeus John Bell. He focuses on a lot of community health and serving the underserved populations. So I will be reaching out to him. He actually has done some speaking engagements at my church. And so I will be reaching out to him as well as a local dentist. She's actually a member of my sorority chapter. She's just moving here. So she is, going to be building her client base here. So I thought it would be good to connect with her as well from a dental perspective.
That's a great idea. You may be able to even write standalone dental plans that her office can accept. So, and because you are sorority sisters, you have an opportunity to actually help her to grow her practice. That's great. That's a great idea. These are the kinds of ideas, and we're sharing them so that you all can start to think outside the box. Traditional works, but creative works better. So think about anything that you feel you can do and do it. There's no reason why you can't try something that you have an idea to do. Go ahead and try it. If it doesn't work, it's okay. If it does work, that's even better. You know, this works, so I need to do more of this particular thing. So this is how you will be able to build year round. So if nobody else, does anybody else have, I don't want to overlook anyone who wants to talk about providers that you're going to reach out to. Again, provider marketing may or may not be your thing. It's
Well,
all up to you.
I'm gonna reach out to Suncoast Medical Associates, PA, and I went by there once. They said yes, and then doing the follow up, I went back, and they had taken all my stuff out. I asked what happened, and they said it was due to COVID. We're just clearing everything out, and
Mhm.
so but they said, come back after things calm down. So I've been sticking my head in there. And so I'm going to go back and check on that. And they also asked if I could be contracted with Ambetter. And so I am contracted with Ambetter, so I can also, because they said they needed agents that could help in
With the
that way.
ACA, yes.
Right, right.
Mhm.
And so I'm going to do that as well. So this is kind of a little kick in the butt I needed to get back over there.
Great. I'm glad that you're going to do that. Make sure that you follow up on that. Don't let it
Mm-hmm.
slip by. Let me just throw this out to everybody. And like I said, provider marketing works for some and doesn't work for others. Some people like it, some people don't. But think about it. If you to create a relationship with the doctor's office, and through that doctor's office, you get one referral a week, you're going to sell that referral for several reasons. One, you've got all of the plans that that doctor's office takes. So you know that that doctor's office takes the top plans or whichever plans. That's something you're going to find out when you're building that relationship. So you know what to offer to that person. The other reason is the person's doctor told them to call you, or you were connected by the doctor. Who doesn't listen to what their doctor says? The doctor told them to call you, so they're going to call you. The doctor told them you would be able to help them, so they're going to work with you. So this is the kind of relationship that you're building. And then on the other hand, when you're working your other sources and you have new members, remember that doctor's office that has been giving you referrals, send them somebody, but every time you send somebody over there to enroll in a Medicare Advantage plan, make sure that you let the doctor's office know that you sent them.
I have a question, Miss Bay.
Yes.
My own personal primary care physician, and I had a conversation back at the beginning of AEP. And long story short, he's in a huge place, I guess, facility with other, I think it's like Texas Health or Health Associates. I can't remember. Anyways, long story short, they have a Medicare person, several that are there, but one is dedicated to their specific company of doctors. But he said that he would send me some referrals. And so the last day of AEP, I actually had a client call and said he was referred by my doctor. We got to talking about how wonderful he was, and I signed him up. So he said, even though I do have someone down here and the person does these lunch and learns with their staff and all this stuff, he still said he's trying to grow his business. I wanted to grow my business, and we kind of came together, but but I don't have any clients in his area except for the one he just sent me. I don't even market or do anything in that area where I used to live. So I'm just wondering, like, I don't know, what do I do? Or do I just continue to do what we've talked about and just start building in that area, even though it's not an area where I have even tapped into, I guess?
How far away is it?
Oh, it's in Irving, like maybe 10, 15
Oh.
minutes. I used to live in the area, so
Yeah,
that's why
okay.
I'm
So-
just around the
So find, something that you could do there
corner. Okay.
in the area
Mhm.
that where you will meet people that you can connect that live in that area.
Okay.
And it could be a senior center.
Okay. Okay.
And then the other way to connect him with that senior center, when you find it,
Mhm.
ask, can you have a doctor come in and talk about heart attack and stroke or diabetes or how to stay healthy or any of that. And just ask him if he will do a 15-minute pop in when you set up that event, so that they get to know who he is in the area,
Okay.
and he gets his face in front of some other people.
Okay. That sounds good. Thank you.
You're welcome. Somebody said, I just set up a Medicare 11 presentation. There's 18 employees, 65 plus, and 24. I don't know why I can't. Mary Lou, tell me what your message says, please.
I had to unmute myself. I actually mentioned at the end of it that we could talk about it later, but
Okay. You want
um,
to talk about it later, or you want to talk about it now?
I mean, I can bring it up now. It's fine.
Okay.
The other company that I work for,
Mm-hmm.
we've discussed that many times, but they've invited me to do a presentation to their employees. They have 18 that are 65 plus, and they have 24 that are between 60 and 64.
Mm-hmm.
Normally, when I go out to talk to these groups, I get 1 to 3 people that show up, but I don't think that's going to be the case this time. But I've been told in the past, when I've been invited to churches to do presentations, that if I'm invited, it doesn't qualify as an event. So I don't have to report it or necessarily follow all the rules. Is that
That's
true?
not the rule. The rule is if it's education, no sales literature, no laptop, no company names, no carrier names, none of that. It's education. You don't have to report it to CMS.
Okay. And there
If
won't be.
you are going to use a carrier, then it has to be reported.
Okay. No, there won't be any carrier information there.
So when you're doing, for all of you, this is a good point. That was a great point to bring out, Mary Lou. When you are doing educational meetings, if you are branding yourself, not the carrier, so you don't have carrier literature, you have your business cards, your portfolio, your brochure, you're talking about Medicare. What's part A? What's part B? What's part D? What's part C? You're explaining Medicare, and you could conduct it right from the Medicare and You handbook. So everything that you say has been printed and issued by Medicare. You cannot give benefits, you can't give copays, you can't talk about plan premiums or any of that. So that is the kind of event, you could call it an event, a class, or whatever, but it's not one that needs to be filed because it's not a sales presentation. It doesn't identify sales benefits. It just talks about Medicare.
I do mention the changes though in the deductibles and things like that. That's okay, isn't it? The changes
When
that
you're
are coming
going,
about
you
for
mean when
next
you're
year.
going through part A and the deductible
Yeah,
is increased and you're going through part B and the annual deductible is decreased? Yes.
right. And the Medicare Part B premium.
Yes.
Okay, I can mention all that.
That's all Medicare. That's not carrier, that's Medicare.
Okay, that's what I do.
Yeah, then you're good. Okay, so now let's look at what we're gonna do today. We spent a lot of time trying to talk about this, so it's time now for us to change gears. I'm going to share my screen. This is day 4. So to summarize, we've already done OEP plans. We talked yesterday about how to plan for lock-in and how to plan for AEP. I am not going to go back through all of that unless someone has a specific question about any of those 3 areas. If you do have a question, let's try to get it clarified right now. For OEP, you're going to be planning right now. You should have been planning earlier in December for OEP. And we're going to do the ultimate checklist next, which is where we do month by month what you should be doing. Leslie can't wait for that ultimate checklist. She thought she was getting it last night. So before I move on, and I want everybody to be comfortable, and if you feel comfortable, that's okay. If you don't feel comfortable, it's okay. Do you have any questions about what you need to do when you're planning for your OEP, your lock-in, or your AEP? Nope. No questions? Okay. Let's look at the ultimate checklist. Here we go. This is what you're going to receive. It is the Medicare Planning Ultimate Checklist for the entire year. And your planning starts in December. December is when you will plan for open enrollment, which is conducted January through March. So you'll have this sheet and you can check off, you can put in the notes, the things that you plan to do during each of those periods, and then you can check them off as you get them done. In January and February,
It's supposed to be on the screen now?
Yeah, you can't see it?
No.
Okay, well, let me do this again. I'm glad you said that. I would have been going straight through this thing and nobody was seeing what I'm talking about. Can you see it now? Okay.
Yes.
Yes.
Okay, great. Makes more sense to you now?
Yes,
Okay.
indeed.
This is the ultimate checklist. We're going month by month. And you can take notes as we go along and you can ask questions. You should ask questions as we go along, but you'll get the checklist as a part of your tools for taking the course. So you'll have it. December, is when you're going to plan for open enrollment, which is conducted January through March. In January and February, those are the months when, if you are considering any contract changes, examples, you are going to switch business partners. You're going to try business partners for different products. Any of that you should, I mean, and this is just so that you can have proper planning prevents poor performance. You need to have everything in place. So you start that process in January or February. In March, you're still in the open enrollment period, but March, you're going to set up and establish your activities and your plans for the first part of lock-in. First 3 months of lock-in is the second quarter, April, May, and June. And this is when you're going to adjust your marketing, your OEP. You might have been in certain areas where people had Medicare Advantage plans and you knew they had Medicare Advantage plans. Starting in March, you're going to look for those places where, in those areas, those zip codes. It doesn't mean that you're physically going to be there, but you need to look for those target market areas where you can market for DSNP and CSNP plans. This is also a good time if you are doing provider marketing because now spring is going to come, April, May, and June, the springtime. People are out and about in all areas of the country. So this is a great time for your provider's office. And it doesn't have to be the doctor, because the doctor may have too many commitments, but it might be the office manager or the nurse or someone from the staff who can go with you to do an event or have an event in their office to talk about a chronic illness in a plan that you represent. March is the month that you're going to start to think about where can you set those things up for April through June. And then in June, you will do your planning for the remaining lock-in months. But remember, July, you're going to slow it down. You're never going to stop. You're never going to come to a halt, but you have to start to back off of the number of activities that you're doing and the number of events that you're doing to get your own business in place and in shape. So in July, you're going to plan that you definitely, as soon as AHIP is issued, jump on it, do your AHIP, and then as the certifications for the companies that you want to work with, and review, look back at what you've done. If you worked this year, look back at the plans that you worked this year. Look back at where your plans fit into the target market area that you have and where you found the most sales. Consider all of that when you're thinking about who you're going to work with. And when the carriers start to have their physical rollouts and their virtual rollouts, attend as many of those as you possibly can. Who else can tell you why their plan stands above another plan than the representative from that particular plan? So you want to hear everything that's going to happen with the 2024 plans when they become available in October. So every carrier that invites you to a rollout, virtual or physical, try to attend, take as much notes as possible, ask questions, set up a meeting with the field manager if you need to, so that you understand what you're going to be able to present to your customers. Because now you've worked in 2023, you have customers already, and you want to get new customers. So you need to know what's going to benefit both segments of your book of business. The same thing that you sold someone in 2023 doesn't mean that that's going to be the best program for them for 2024. There may be changes. There may be drastic changes. You know, Medicare Advantage plans change every year. Some significantly, some very slightly. So you need to go to those rollouts so you understand what the changes are. You're going to start in July to think about where you're going to be and what you're going to do every day of the AEP that you are working. And it doesn't matter if you're working from home or you're working face-to-face, you need to have a plan to work every day that you have committed to do so. And for those of you who have full-time jobs, you will need to decide what days you're going to work on the weekend and what times you're going to work after your full-time job. In August, you want to confirm all of the things that you have set up, all of the places where you say you're going to be. You're going to be at Dr. Schmo's office every Tuesday morning, and you're going to be at Dr. Horton's office every Tuesday afternoon. So you're going to be at Dr. Schmo's, say, from 10 to 12, and you're going to be at Dr. Horton's from 1 to 3. So you need to confirm that this is where you're going to be. The reason you are confirming is because if you're going to have it set up as a sales event, it needs to be registered, it needs to be filed with CMS. So you need to submit these plans to your upline, your field sales manager for the carrier, so that they get filed. Otherwise, it will be education. You will not be able to take applications there on site. In September, you will start your customer outreach. You are still not able to talk about the next year's benefits, but you're actually preparing your existing customers for AEP. You're sending out your pre-AEP letter to your existing customers. You're letting them know that the new benefits will be available October 1st. These are your office hours. This is where you're going to be. These are the places where you're going to be, what days you're going to be there. And for them, ask for them to reach out to you so that you can review. Now, everybody will not call you and everybody will not reach out to you, but those who don't reach out to you, you will need to reach back out to them to set an appointment. And for your existing customers, the best time to talk to them would be between October 1st and October 14th. Because some of them are not going to change plans. It just might be an ANOC review, an annual notice of change. So once you go through what the changes are in their plan, they're happy with it. Hello, goodbye, thank you very much. Thank you for being my customer. If there is a change, then you'll need to set an appointment with them for after October 15th. October 15th to December 7th, your head is down and you're working. every one of the days that you committed to work. You have every day filled with some activity, some event, something that you're doing. You're at the senior center on Monday mornings or Monday afternoon. This is not probably the time when you want to go there for bingo. You want to go there to set appointments. I hope that's clear, because you had all those other lock-in months when you could socialize and be with them to do bingo. But now you got to work. And then wrapping up the year after the,
So, excuse me, sorry to
Mhm.
interrupt you. When
it's
you
okay.
said during AEP, you wouldn't be playing bingo, so you would kind of set up a location for people to come to you with questions and enrolling, things like that. Did you
Right.
have
I
some
mean, if
kind of
it's, if
educational event or anything like that? Just set up and come to me if you have questions.
if you, let's take the one place where you're doing bingo now.
Okay.
So you do bingo there, say every other month or so, you do bingo. When the AEB comes, when September comes, you make sure that you go there and you make it a festive occasion. And the reason being, in September, you're going to say to them, AEP is coming. After October 1st, I'm already set up to be back here on October 12th. I'll be here October 12th from, I mean, it all depends on how many people there, from 10 to 2 or 10 to 12. So I have a sign up sheet here. You can, place yourself in an appointment. I'd like to meet with you one-on-one so that I can tell you what the new benefits are for 2024. So when you go back there in October, you're not going to call bingo.
That's excellent. Thank you.
Same thing in November. Don't call bingo. If you find bingo works for you, but it's not a sales activity.
Yeah, I wouldn't think that'd be a good use of the time. Play bingo.
I mean, and if you explain it to them and listen, you always have to give people the impression that you're busy. Otherwise, they won't think that your time is valuable. So during this time, there are so many people that I have to see that, I'll be back to call bingo in January.
Thank you. That's a great plan.
Work it as best that you can.
Mm-hmm.
When you go back in September, that event is not filed. No, not if it's bingo. You're not talking any carries, because in September you can't talk about the plans for the next year yet anyway. You can't talk about plans until October 1. Anytime that you add an event and it's a like a bingo thing and somebody wants information, then of course you have to get a scope of appointment and you're going to meet with them one-on-one. It's a one-on-one appointment. It's not like a seminar or a sales presentation to a group. So when you go in September, it's gonna be a fun thing. I mean, it could be a fall festival or whatever, but that's when you're gonna ask them to sign up for the appointments for October, and that's how you book yourself. And that's why the month before in August, you kind of fill up your calendar so you know when you're going to be back at that place. And you also know the days that you have open that you can set appointments with them. Does that help, Deborah? And then in December, you're gonna finish the year. After December 7th, you still have your IEPs and your SEPs. Another note, someone who is going to be eligible January 1, and it is AEP, and you are slammed. Talk to them, get their scope of appointment, set their appointment for December 8th. There's no reason you have to see them December 7th unless they're anxious and you get that feeling, that unction that they're not going to wait for you. Go ahead and do it. But if they can wait till December, just say, well, I'm booked up. I have appointments, but I can do December 8th at 10 o'clock. Does that work? Does 10 work or 2 better? So your IEPs that are going to be January 1, if they've waited, you can do them December 8th through December 31st. You don't want to wait till the end of the month to do them because you want them to have their cards and everything in place on January 1. Same thing with the SEPs. If you have special election because of disaster or special election because somebody moved, you don't have to do that by the 7th. You could do that the 8th, 9th, 10th, 11th. And after you finish the AEP, start immediately to look at, and as you're going along, you are going to be tracking what you're doing every month because you'll be able to adjust what you're doing. If something's working really well, you need to do more of that. If something's not working, you need to get off that dead horse. So as you're tracking what's working and what's not working, and you create these relationships with the provider offices and your referral partners and all of these ways that potential sales are coming to you, you are generating those lasting relationships that can help you not only 2023, but 2024 as well. Okay. Are there any questions about the ultimate checklist? I got a smart group again. Can you see my screen and I'm back to our agenda for today? No?
We see you right now.
Okay. Okay, how's that?
Yes.
So we just finished the ultimate checklist, the monthly planning. So this is our Q&A. So go ahead, throw those questions out there for me.
I just want to say, I wish I had known that plan that you just told me about, the retirement center. I wish I had known that this year, because that would have been, it would have changed things for sure.
Remember, you got to treat your business as a business. And the kind of business that we're in, we're pulled through different directions. But your bottom line depends on how well you can control what happens with your business. So the seniors may love for you to come to do bingo, but somebody was doing something with them and they were doing well before you did the bingo, and you're going to be there many months during the summer and other festivities. You're going to get to know them very, very well. the people who actually want to change or need changes will be the ones who will reach out to you. The other thing is, don't put all of your eggs in one senior center. I think I asked sometime during the course, how long did it take for you to do the bingo? And it's no more than about an hour and a half. So you could do one place in the morning and one in the afternoon.
So Ms. Fay, you're from what you said, I guess I was thinking about the certification month. So it's June, July-ish for certifications, and then August you're really kind of gearing up for AEP. That's what it looked like.
Exactly, because the sooner you can get your plan done for what you want to do to hit your goals, the sooner you'll be able to communicate that to your business partners. And your business partners have to move that up the chain. Some people work directly with the carrier managers, and that's good too. That's an excellent thing. But others, have to go through that chain. So if you're planning to have or think you need some support or some help, or you may even want to do, if there's somebody else on your team that works in the same area, you may want to do some events together or whatever it is. It does not hurt for you to plan those things ahead and kind of know what you're doing. The certifications seem to come out earlier every year. The carriers now seem to see who can get it out first. And then United Healthcare, of course, does not require AHIP. So as soon as the United Healthcare certification is available, unless they change it, you could just go right ahead and do United Healthcare. Any other questions?
Ray, I did have a question. I may have been missing the boat here with the provider marketing. You said that we should be asking them for referrals, not just saying that we're going to bring them new patients and working from that side. We should actually be requesting referrals from them or offer ourselves as a resource to them. So I got that right?
It's a two-way street, yes.
Excellent.
But the point that I wanted to make is, don't go in there announcing that I'm here because I want you to refer your patients to me. Go in with the fact that I am able to bring patients to you. And as you create that relationship, you will get an opportunity to ask that office manager. So how do you handle the people who are turning 65? Do you have a good number of people who are going to be turning 65 in June? Remember, they have databases and they can't give you out that information, but that office manager can run a list of everybody whose birthday is in April. And when she runs that list of everybody that's in April, let's see, what year do you have to be born for next year? 58?
Yeah.
58.
Okay, so she runs a list of everybody who was born April 1958. And you ask her, do you mind just, sending them a postcard or sending them an email or a text or something, and let them know that I'll be here at your office, whatever day they can stop in, we can talk about Medicare, or they can call me. Now you're helping her and she's helping you.
Sounds great. And lastly, Leslie, I sent you a direct message. Thank you, Faye.
You're welcome. Any other questions? Okay, so then everybody's ready, set, go. You're all ready to go to do your plan for 2023, right?
Oh, I did remember something. A friend of mine is building his website, and it's WordPress. And he said that WordPress works with certain apps you can just put in it or attach to it or work with it. And he said there are free CRMs that you can get to attach to your site, and use as long as the site is active, your CRM will be active. So that's one option you can look into as well.
Very good. For those of you who like WordPress, I found it very difficult, but that's good. Good information. Thanks, Greg.
You're welcome. I'm surprised you
Any,
found it difficult, but that's another conversation.
yeah, it was cumbersome for me. Um, everybody who feels confident that you can now make a plan that will generate for you income. Cordia says yes, ready, set, go. Kayla says thank you. Everyone who feels that you can now make a plan, you can at least start, even if you don't know how to plan it out for the whole year, you can start some plan that will at least get you to making some money. Tell me with a 1. I always use number 1. Number 1 is easy. Okay. Yes, ready, set, try. Okay. I armed you with a lot of information. Now, that's not everybody, though, and that's okay. So this is what I want to offer to you. And that's your next step. For those of you who feel you may not be ready to actually do this plan yourself, and this is an offer that's only to a certain number of people. My business is growing. However, I'm not grown so much so that I have 6 or 7 associates who could come in and do what I do. Not yet, but it can happen. So right now, it's only me that does this part, and then my VA does a lot of other stuff for me. So I can only work with a certain number of people. I want to just make that clear. I can't work with everybody. But I would like to offer to those of you who are in this particular course an opportunity to have your plan for the year built. And that would include working in your particular target market area, giving you the resources such as the provider names, the ones that may be viable candidates to work with, other activities and events that you can do throughout the year. The numbers will be set up so that January, February, and March may be busier than April, May, and June, or April, May, and June may be busier based on what your schedule is. So it's a customized plan for 2023. And you'll get that plan for the entire year. Included with that is a one-on-one once a month because we need to review where you are, how the plan is working, and if there are adjustments that need to be made to the plan. So it's customized, it's personalized, it's only for you. That plan is only for you. Now, this is a package that I will be offering to everyone else, not you, for $497. Because you're here, you can actually have that package, get an annual plan written with all of your activities set up based on what your schedule and your goals are to meet those goals, and the review every month to see where you are and what needs to be adjusted for $197. And that offer is only to the people who are in this group. There are some of you here who are coaching clients currently, and you have that opportunity. So Dee, you already got your plan. You got your spot. This is a different offer, and it's only to the people who are here. And I should have said who are not currently coaching clients. So if you are interested, I'm going to share with you let me do this. Okay, this is if you are interested, all you need to do is take your phone and go to the website, and we'll be in touch with you.
Okay, Faye, help me out here. All I'm doing is taking a picture of this. I haven't mastered this yet.
Oh, well, if you put your camera, point
Yeah.
your camera to it, it'll direct you to a link, and you click on the link on your phone.
Oh, okay, well, I'm not seeing a link. Okay, all right, thanks.
And Lawan, the ultimate checklist we've gone over in this session, it has not been emailed yet. So I am thinking that at this point, most of you are ready, set, go. I'm so happy that you are. But if you're not ready, set, go, and you just need some help, go ahead and take a picture. If you, the link and the QR code will be sent in your email today. So if you can't get it, it's okay. Mary Lou says she is using her phone to do this, so she can't access the camera. That's okay. If you can't get it now, it's okay. You will have an opportunity to use it when it comes in your email. And in the email will be the ultimate checklist. Yesterday, I gave you all my contact information again, so that if you have any questions about what to do, you can certainly reach out, and I'll do my very, very best to help you to get started. If you want your plan done for you and you work it. Now understand, I'm not going to work your plan. I will lay it out for you and tell you where you need to go and what you need to do and who you need to call and when you need to call them. But I am not going to make those calls for you. But you will know this is what you need to do. Maureen says, I appreciate you sharing your experience. I did this. Oh, you're so welcome. Before we go, and Kayla says you have to make sure that your Wi-Fi or data is on when you get the QR code. Before you go, last thing that I'm going to ask of you is, if you will, do me a favor, and this is, I need help, and I need your help. If every one of you will in the chat just put one statement or one comment or one thing about what it is that you either learned from this course or that you gained from the course, or that has changed something that you will do from this course. Any of those kinds of comments, and I just need one comment from everyone, please. Thank you so very, very much. Oh, I'm glad, Maureen. You're ready for 2023 now, aren't you?
Yes, I am.
Good. Now, there may be those days that come that things aren't going the way you thought they were, but just remember, don't stop. Don't ever give up.
Shannon's husband and my husband said it's time for us to make money.
Okay. And you know, most of the things that I've offered to you don't require a lot of money for you to spend to do them. It takes time, but not a lot of money. These are all good comments. Is everybody reading the comments in the chat? The one reason I asked everybody to make a comment, because we all perceive things differently. So I thought it would be a good idea if others got to know what you got from the plan and what you thought about it. So thank you all. Thank you very, very much. Craig's going to be a better agent. He's going to be a star. So Craig, now you know, come October, you're not going to be calling bingo, right?
Yes. Yeah, I should have talked to you about that this year. Yeah.
But you can still, you can use those centers very wisely. But throughout the year, you can even be gathering your names of people who you're going to contact during the AEP. I'll leave you all with this one note. If you want to have a good list of people that you're going to have appointments for starting October 15th, start in January to build that list. And just keep in touch with them throughout the year. I think most of my sales for the past AEP, for this AEP, were people who already had Medicare. a good bunch of them were people who had Medicare supplements. And now that they are in their 70s, they're beyond 65, they're in their 70s, the Medicare supplement premiums are higher. The prescriptions, because of the number of prescriptions they use, their prescription drug benefits cost more. So it was that time when they should look at, is it less out-of-pocket cost to have an overall maximum medical plan with the $2,400, $2,900, or $3,400 maximum than it is to pay $300 a month for a Medicare supplement,
Yeah.
plus a premium for a Part D plan. So you will find opportunities everywhere that you look. And if you don't look for opportunities, you won't find them. If you're home in the bed with the cover over your head, opportunity's not going to knock at the door. Thank you all so very, very much. Let me know if there's anything else that you need. And I will make sure I made a list of the people who said they don't have something. If you don't get that in with tonight, I needed a reset, and this course offered has helped me regroup. And I'm moving into year 7. I'm refocused now. I have it clear. For you, I can see that DP. I knew that was deep. Yes, I mean, sometimes we get that. We get to that point.
Thank you,
But
Ms.
it's
Ray. Great information, Ray.
You're so welcome.
This whole course has been very helpful.
Good, thank you. If there, anybody else have any other comments, anything else? If not, I'm going to wish you not only a happy new year, but a prosperous new year and a prosperous 100 Medicare sales in 2023. So long.